The last estimates that we did in the World Health Organization is back from 2014, and it said that around 422 million people had diabetes. But we know this number is no longer valid. It means we know that more people they are living with diabetes today, and we are currently updating these numbers. The last estimate, which is not from the World Health Organization but International Diabetes Federation, said that more than 500 million people are currently living with diabetes, and it predicted to rise even further. Before, we had in May 2021 the resolution on diabetes, which is like an agreement, you can say, by member states where they agree to reduce the risk of diabetes and strengthen the management and the monitoring of diabetes. So the member states have committed to this document, which gives them a lot of recommendations of what they should do to raise diabetes on the agenda, but it also gives us a lot of demands that we should do in the World Health Organization. And one of them, or the way we try to do this, is through the Global Diabetes Compact, which we launched in April 2021. And this has like several aspects of diabetes, which both includes prevention and also management of diabetes.
This number is projected to increase by at least 80% by the year 2045 if nothing is done to address the risk factors and the drivers of this disease. In Africa, over 24 million adults are currently living with diabetes, with that number predicted to swell to approximately 130% to 55 million by 2045. By the end of 2022, diabetes alone accounted for over 600,000 deaths on the continent of Africa, and is forecast to become one of the leading causes of death by 2030, the year that we're supposed to attain the SDGs. Here in Ghana, similar epidemiological trends have been reported, with approximately 7.5% of adults, the adult population, living with type 2 diabetes. Distinguished ladies and gentlemen, risk factors for this condition are known and include family history, age, modifiable risks such as overweight and obesity, sedentary lifestyles, unhealthy diets, tobacco smoking, and alcohol abuse. Unfortunately, modified risk factors are on the increase across the countries of the WHO African region. And it is therefore not surprising that the number of NCDs and diabetes are also on the increase. Response efforts have constrained largely because an estimated 50% of persons living with diabetes in Africa have never been diagnosed. Indeed, we only know that they are diabetic when they turn up at the health facility in one of the diabetic crisis tools, and also determine the true extent of NCDs and diabetes through the planned STEP survey, for example, if we are to appreciate the true burden of this condition on the continent. Left unchecked and without management and lifestyle changes, diabetes can lead to several complications: heart attacks, stroke, kidney failure, low limb amputation, visual impairment, blindness, and indeed peripheral nerve damage. As we heard in the earlier presentation, to accelerate progress on diabetes and other NCDs, the World Health Organization developed the Global Diabetes Compact, that everyone living with diabetes has access to equitable, comprehensive, affordable, and quality treatment and care, which aims to improve services to prevent and manage diabetes care and achieve universal health coverage. This strategy focuses on integrating outpatient care for severe and chronic non-communicable diseases at the first referral level health facility. This strategy also calls for the strengthening of capacity at these facilities to diagnose and manage type 1 diabetes and other severe non-communicable diseases. If fully implemented, this strategy will contribute to the reduction in the number of deaths and improve the quality of life of African children living with type 1 diabetes.
Stroke, cancer, diabetes, and chronic lung diseases are collectively responsible for 74% of all deaths worldwide. More than 3/4 of all NCD deaths and 86% of the 17 million people who died prematurely or before reaching age 70 occur in low and middle income countries. Globally, about 422 million people worldwide have diabetes, majority living in low and middle income countries, and 1.5 million deaths are directly attributed to diabetes each year. Both the number of cases and the prevalence of diabetes have been steadily increasing over the past 5 decades. In our country we call Ghana, there is a national prevalence of between a little over 2.4 million persons living with diabetes. But I believe this is only the tip of the iceberg, since a number of people have still not been diagnosed. Diabetes is a chronic disease that can lead to a range of complications, including heart diseases, stroke, kidney diseases, blindness, and amputations. It not only affects the health and well-being of individuals, but also imposes significant economic and social burdens on families, communities, and the entire healthcare system. People living with diabetes and other non-communicable diseases suffered severe morbidity and mortality during the COVID-19 pandemic. Therefore, as part of efforts to ensure health security and sustain efforts toward pandemic preparedness and response, diabetes and other non-communicable diseases need to be urgently addressed. Ghana remains committed to ensuring the prevention and control of non-communicable diseases. In April 2022, Ghana hosted the International Strategic Dialogue on NCDs and SDGs to raise the priority accorded to NCDs. Ghana signed on to the Global NCD Compact to accelerate efforts toward achieving SDG 3.4 and 3.8. Furthermore, the President of Ghana chaired the first gathering of heads of state and government on NCDs at the UN General Assembly to begin a global conversation about the urgent need to address NCDs. That was last year, and I was privileged to be part of that gathering. The National NCD Policy and Strategy clearly provides policy guidance and outlines strategies to prevent and control diabetes in our country. Through the current Norwegian Development Agency project, several healthcare workers at the primary healthcare level have been trained to screen for and manage diabetes and other NCDs. This is a project we call NORAD. The challenges of non-communicable diseases, prevention and control is a Herculean task that requires the support of various partners and stakeholders. The World Diabetes Federation support in addressing diabetes prevention and control in the country could not have come at a better time. Within the already established NCD policy framework, and with the support of partners such as the Ministry and Ghana Health Service, we can improve access to diabetes care and treatment in Ghana, to reduce the burden of diabetes on individuals, families, and communities, and ensure that people with diabetes can live healthy and productive lives. We must prioritize the prevention, care, and management of diabetes in Ghana and support the goals of the WHO Global Diabetes Compact. In conclusion, the diabetes epidemic is a significant public health challenge that requires our collective action and commitment. Let us work together to support the implementation of the WHO Global Diabetes Compact in Ghana and take meaningful steps towards improving diabetes prevention, care, and management in our country.
Diabetes affects 243 million people worldwide. Out of the 243 million people worldwide, we have 24 million people living on the African continent. And if Ghana has recorded 2.4 million people living with diabetes in Ghana, which means a small country of Ghana with a population of 30 million, we have 10% of the population living with diabetes. Most women, when there is a postmortem after mortality, about 40% of women who die of medical conditions died because of a non-communicable disease, which we have given a nice name as comorbidity. About 470,000 people were amputated on the African continent. In Ghana, on record, so far we have almost 8,000 people. But then we quantify the impact on life dependency. So if each of them have even 10 dependents in their family, we're looking at 70,000 who were affected by amputations in 2022. So retrospect everything. We're going to, number one, educate the general public on how to identify food problems. We're going to sensitize people to check their sugars, check their blood pressures frequently. We're looking at establishing a call center where people can call when they have problems and have people to answer. We're looking at also introducing the Catch Them Young program, because if you catch a child, teach the child good lifestyle. When he goes home, you will correct mommy if mommy is making a mistake. And then by correcting mommy, you educate a woman, you educate the whole nation. Eventually, in a few years, we should be living a healthy lifestyle. So we're going to sit with Ministry of Education and Ghana Health Service so that we introduce AMPE, Tumantu, KBZ, all those games we used to play when we were children, which has vanished, so that at least it's incorporated in the curriculum of children. We know it's difficult to ask, but if we can also sit with them to incorporate a fruit in season when they are doing the school feeding program. Word of advice on your status. Check your sugar frequently, check your blood pressure, eat well, eat right. Don't put something in your mouth when you wouldn't know the outcome.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.